Stark State College Massage Therapy Lab Notes with Michael Vahila, licensed acupuncturist and licensed massage therapist. So before beginning abdominal massage, you'll want to drape the client's chest by taking a pillowcase, folding it to the appropriate size for the pillowcase and the client. And as you hold it up there, you can just bring the sheet out from under. And then you'll also bring the sheet down, and if they're wearing underwear, you'll tuck it into the underwear. Again, you want your hand to be resting on them gently. Apply some lubricant. And warm it. And you're going to start with just some light friction. And I do this in a circular motion. Sometimes this can look a little confusing, but what's happening is one hand is actually going continuously, and then as that goes down, the other one comes around. So it creates a quality of continuous flow, but really only one hand is continuously flowing. And for me, it's my left hand, and then the right hand comes down. So this is just to apply the lubricant. Also doing friction on the sides. So pulling along the sides. And with this you can really reach under the back. This actually feels quite good to come under the back and traction along the sides. And then as you walk around to the other side, maintain contact. So maintaining that contact as you get to the other side and then tractioning again. Reaching really as far under as you comfortably can. Sometimes I will also do that with two hands, but this depends on the size of the client and the height of the table to reach under the back and friction and lift up on both sides. If you traction down on the low back, that can feel quite good. It's a decompressing effect on the low back. And you may or may not be able to comfortably do that. And then you want to do some digital kneading. Now again, remember, we're working from the Kellogg text, and he made a big deal out of doing digital kneading on the abdomen. So you're just really following the line of the large intestine. Now they don't have to necessarily know that that's what your intention is, but that you're going in small circular motions, starting at the lower right quadrant. When you get to the level of the navel, going straight across, which would be the transverse colon, and then down on the left side. So that's just a little bit of digital kneading, and that's in the routine to just demonstrate something that was in the Kellogg text. And then, as always, you can throw in friction strokes as part of your transition. Then to do the abdominal muscles, so we know the rectus abdominis is straight along the front of the body here. And the way to do that is support just on the lower part of the rib cage, and then you're going to use the fingertips in almost like a scooping motion like this. But this hand is here to stabilize it so you're not just pulling skin. And you're scooping downward in about 3-inch segments, and then move to the next segment. And this is going in line with the fibers of the rectus abdominis muscle. And just down to the pubic bone. Then you're just going to move a hand width lateral to that. So this was the rectus abdominis, the oblique muscles. And you don't really have to worry about that so much, but you're still just doing that scooping motion of friction along those muscles. Then you're going to come around to the other side. And again, just supporting with a little pressure on the upper hand, coming along the rectus abdominis. Just 3 strokes in each segment. And this is just moderate pressure. One of the differences here is, unlike on the back, there's no hard structure to press down on. Right on the back you have the ribs and the vertebrae. So here, and as you move lateral to that, so you're just pressing down into the viscera, so you don't want to use too much pressure. So that's doing the main musculature. And then again, you end with some friction. Also, this is a fairly brief abdominal massage routine because it is in the context of an entire hour massage. So we don't spend too much time here. If you can comfortably do the maneuver where you reach under the client and traction up and pull down simultaneously, people really like that because it really decompresses the spine. And then simply end with a moment of passive touch. Then after you've finished that, you bring the sheet back up and simply grab the pillowcase and pull that out from under the sheet, and then from here you'll turn the client over to do the back.